Moving on to ear diseases and disorders, also a specialty that you may see intertwined into other specialties in which you work. So for instance, cerumen impaction, this is earwax. This could be something that's in general practice. You could see this if you're working with children, if you're working with elderly, just kind of intertwines in other specialties. So cerumen is a clinical term for earwax. And there is such a thing as cerumen impaction, where the patient may be required to have an ear lavage. An ear lavage, also known as an irrigation, is something that a medical assistant can do to assist with removing excess earwax in the ears. Now, mind you, I'm not talking about just the basic wax that you have in your ears. That's protection. We need some of that wax for protection against pathogens. Remember, this can be related to as a bloodstream or direct relationship to the bloodstream. So we do want to have some earwax there. That would be healthy. However, there are some patients that suffer from impaction. And when that impaction occurs, it can cause other problems. And so we would need to assist with removing that. Otitis externa is a clinical term for swimmer's ear. And swimmer's ear is going to require medicated drops. Again, they'd be prescribed, written in a doctor's order. We may do them in the office, and then the patient may require education and instruction on how to continue the care once they get home. And then the last one there we have is pruritus. With pruritus is just an uncontrollable, unexplainable itchiness of the ear. Now, looking at the components of the ear, you have the internal ear, the middle ear, and external ear. All of these have the ability to become infected. And notice here, when we mention ear, nose, and throat, they really are connected into one. Here is the eustachian tube here. Now, in this diagram, they're showing you an accumulation of fluid in the middle ear, which is actually very common. So with otitis media, that's going to be a middle ear infection. This will require oral medication. Otosclerosis. Sclerosis means hardening. This is a hardening of the bones in the middle ear. As we speak, as we hear sound, the vibration of the sound that we're hearing bounces off of the bones, makes its way into the nerve so that we can transpose that into sound. If the patient is suffering from otosclerosis, there is no way for the sound to be able to vibrate off of the bones. And so over time, this can result in hearing loss. Interesting thing about the ears is that we do have the ability to take bones from a donor and place them into someone else's middle ear. So this is really an outpatient surgery that can occur that can replace the middle bones that have suffered from hardening and replace the patient's hearing. Now, the last one there is labyrinthitis, and labyrinthitis is associated with vertigo, which is dizziness. This is an infection of the inner ear. And again, internal ear, middle ear, external ear, all have the ability to receive infection or have infection, I should say. Moving on to common disorders of the inner ear, we have Meniere's disease. Meniere's disease is going to be similar to tinnitus. I want you all to make sure that you don't get the two confused, as tinnitus is just ringing in the ears. Meniere's disease is associated with age. So it's also going to be ringing in the ears that leads to dizzy spells, can affect the hearing, can lead to hearing loss, usually only affects one ear, and starts between young and middle-aged adulthood. So a lot of students tend to get these confused, but keep in mind, as I said, tinnitus is just ringing in the ears, whereas Meniere's disease is going to be the ringing in the ears along with the dizzy spells associated with age that could result in hearing loss. Ruptured eardrum is what you see in the picture here. This is a perforation of the eardrum, which could lead to hearing loss as well. And then presbycusis, there's that prefix again of presby. Remember, presby has to do with aging. Cusis is hearing loss. So this is going to be hearing loss due to aging.